What we got here is failure to communicate, a chronic neglect of military mental health care. This is Psychiatric Casualties, how and why the military ignores the full cost of war.
Well, good morning, Charles.
Hello there. How are you, buddy? It's afternoon here, almost afternoon here.
Yeah, we're on the different side of the coast. And before we get started, I just wanted to, get a shout out to Cindy Thompson and her team at Coming Home Well, who afforded this opportunity for us to, talk a bit about some of our experiences in the military, and in particular, of course, with military mental health care and where we, the books that we've written about that topic and so on. So really appreciate that opportunity.
I agree completely. It's an unprecedented opportunity, frankly, and we are not exactly seasoned at this, but we're confident that we'll catch on. Doesn't seem like it's that difficult just talking. Well, for some of us, maybe it's not difficult to talk. But yeah, it's going to be fun and engaging, and hopefully we'll include those of you who are listening. We need you to give us feedback and essentially to say where we are or not on track. But our purpose will be fairly clear after this session.
Yeah, and we talked about that, and it would be awesome to get listeners' feedback, questions they have or reactions they have to things we say that we can talk about in future episodes. So towards the end of today's episode, I'll provide an email address they can reach me at and reach us at, and that will allow people to provide some questions or reactions, and then we can go from there.
Well, let me just jump in and introduce myself, and then
good.
Introduce himself. I'm
Please.
Charles Figley. I'm a professor at Tulane University. Started blocking here for a second. At Tulane University in New Orleans, have been there since 2008. I was at Florida State University before that, and before that, Purdue University. Full
Wow.
professor. I'm a tenured, and there's a title or whatever. I'm a fellow, I think.
A distinguished fellow, I believe.
Distinguished fellow. Okay, that I always forget that part. I don't feel very distinguished.
Oh my
But
goodness.
Mark and I together have published articles, at least a dozen, and we have published two books. The most recent one is Psychiatric Casualties, that we will be talking about definitely the next time we're together, and we'll be talking about a lot of other things. But let me just say, I got started in this when I got out of the Marine Corps back in a long time ago, and I became interested in psychology while I was in the Marine Corps. I'd taken a couple of classes in English, not really focusing on psychology, but it took off because as soon as I got out of the military, I got out of my car and went to class at Ohio State University, even though I was down in North Carolina at the Cherry Point Marine Corps Air Station.
Mm-hmm.
But yeah, in the schoolwork, it became very clear to me that I was remembering relatively easy my experience being in Vietnam. And it was something that I was a little wary about, but I just kept going and all that. And I was very happy and glad I was out of the Marine Corps finally, and after 4 years. But the thing that emerged in my life after that was really a combination of understanding what I went through and recognizing that I wasn't as lucky as a lot of men and women who've been in the Marine Corps in particular, but also just generally in the military.
Mm-hmm.
So anyway, long story short, after all my schooling, I was able to become a professor, and I've published quite a bit of articles focusing on military veterans. I wasn't so concerned or care that much about the military generally until I met Mark. And since we have met numbers of years ago, that's a lot of our work is connecting the dots in various areas, but particularly in terms of Mark's impressions that he will hopefully talk about soon about the whole notion of being in the military and how you get caught up in this big, huge, I'm going to say meat grinder, but I don't mean that in a negative necessarily way. You just get lost in the shuffle,
Yeah.
the crowd, in effect. So, Mark,
Well,
where do you come from?
before I go into that, though, what years were you in Vietnam?
I was 65, 66.
Oh, so pretty early in the conflict then.
We were among the first offensive troops there.
Yeah.
With all of that discovery that was helpful for people that served after us, but we were the ones that stumbled onto the various experiences.
Yeah. Well, I just want to, before I again go into my kind of narrative, how I got involved in this, was just to kind of mention to the readers who may not be aware of exactly who you are, but you are, in my eyes and in many people's eyes, a pillar when it comes to the field of trauma. And you were a pioneer. You led efforts to get PTSD recognized as a genuine, war stress injury, or traumatic stress injury, I should say, more broadly. You wrote one of the very first books on Vietnam War syndrome in the 70s, as well as the effects of war stress on families. And if I'm not mistaken, you also coined the term secondary traumatization in regards to that word. Am I right about that?
Yeah.
Yeah. And so when I was doing my dissertation, I relied heavily on your seminal work. And you have published hundreds of books and thousands of articles, and you're one of the most published and renowned traumatologists that we have a pleasure of meeting and learning from. So I stand on your shoulders, my friend.
Wow.
Yeah.
Okay.
I don't think I ever shared that with you, but
well, thank you, man.
True sentiment.
That very much. I'm feeling thoroughly uncomfortable here, but
yeah, sorry about that. All right. So,
thank you.
And I'm just curious, did any of your family members serve in the military?
Oh yeah, my father was in the Army during World War II.
Yeah.
And my uncle, his brother, he died a few years ago, Charles Figley.
Oh.
He served in the Marine Corps in Korea. So that's kind of amazing.
That is amazing. So here's a couple of points where our lives intersect, besides our role in the mental health and, talking about military mental health care, but our personal lives. First of all, my father was a career Marine, enlisted Marine. He was a combat veteran of both Korea and Vietnam. And so I don't know if your paths may have crossed at some point. Who knows, without knowing that. But also, I had a couple uncles who died in Iwo Jima and Guadalcanal each, both of which were Marines, and then uncles who served in the Army in Vietnam. And then I had, of my brothers, my oldest brother was a career Air Force, and he deployed during the first Gulf War. I have another younger brother who served in the Air Force, and another younger brother, Brian, who was a career Air Force enlisted person who deployed to Afghanistan and other places like that. So I come in, and I lived on a Marine Corps base for most of my life. And in 1968, which was the height of the Tet Offensive, I was living on Camp Pendleton Marine Corps base in Oceanside, where I lived there for a few years, and my father was deployed at that time during the Tet Offensive. And one of my most vivid memories was I was about 8 years old in the third grade at a San Rafael elementary school on the post, right? And we started hearing the loudspeakers would go off, whether it's during class or recess, and it was from the principal's office. And typically what happened, we'd be in a classroom that would go off, and they would announce that a student's name to come to the door. Did I share this with you before? Story?
It was in the movie, I think.
Oh, it might have been. Right. All right. But so we were instructed to put our heads down on the desk and keep our heads down, and a student's name would be called. They would go to the front door accompanied by our teacher, and they would meet a group at the door that was the principal, the vice principal, a nurse, and somebody in uniform who I guess now was a chaplain. And this would be names of people that friends of ours who we were playing with during recess just maybe 30 minutes ago, and we would not see them again. They would disappear from our lives. And one day, one of my best friends, Rodney, that happened to him. His name was called. I looked over. I was panicked. I thought, I lost my best friend. And I followed him with my eyes as the teacher accompanied him to the door, and he was met by that entourage, and then disappeared from school. But I took my bicycle that day and pedaled over to his home, which was a few blocks away. And then Rodney could not come out to play. His mom was very tearful and very sullen. And so I came back about a week later, and there was a moving truck, and I never saw Rodney again after that. So that moment kind of overlaps, a bit with your stay in Vietnam, and I'm back home on a Marine base as a family member, and I'm living through what was, one of the largest battles during that time in the Vietnam War. And that kind of set something in my mind. And eventually I joined the Marine Corps myself, following my father's footsteps, and I was enlisted. And we both, I think, rose to the rank of sergeant, if I'm not mistaken. So Sergeant Figley, Sergeant Russell, and when I came in 1979, I saw all the remnants of Vietnam. I mean, there was people who were really kind of that 1,000-yard stare. Substance abuse was rampant. There was marijuana. You could smell that outside the barracks. I mean, it was just, there was no drug testing during that time. So you could see the effects, the lingering effects of those who had served in Vietnam and stayed on active duty. And so I started recognizing that. And then eventually I got out after 10 years and to pursue a doctorate in psychology. And that's where I learned about your work. And because my interest had been about trauma. I saw some effects on my dad and changes in him each time he came back from deployments to war. And it just kind of sat in my brain, and I started becoming interested in psychology, understanding more about trauma, and then did my dissertation on Vietnam combat veterans. And so got to interview dozens of veterans, both from Korean War and World War II, as well as Vietnam. And from there, that's where I, again, lit the light. I wanted to go back in the military as a psychologist. And I had all this literature at that time about the effects of war stress and how the military's dealt with war stress was kind of in my mind. And then when I deployed in 2003 in support of the invasion of Iraq at a field hospital, we did some dog and pony shows about some of the innovative things we were trying to do. Like we did combat stress screenings for everybody who came through our field hospital to identify them as maybe needing follow-up when they get to Walter Reed, when they transfer back to the States. And did some reconditioning programs and other things to help rehabilitate folks, while they're still in country. And then we had the highest ranking military psychologist, an admiral in the Navy, came through our field hospital, and we gave them the dog and pony show about how many people we saw and how many people we screened, how many people we identified early as needing help, and kind of so they don't fall through the cracks, etc. And his statement was, well, this is all, very interesting, very good work, everybody. But unfortunately, it'll all be forgotten and it'll have to be recreated by somebody else. And that immediately hit me hard, because that was in the back of my brain. All that research I had done and all my lived experiences and reading the books that you wrote and the articles that you wrote, it kind of came back to me that we're repeating history in the 21st century. And we'll talk more about that history and in future episodes. But that's what got my interest in it. And then both of my sons, that is, joined the military. One was a Fleet Marine Force corpsman assigned to the Marine Corps in Afghanistan, and the other was a Marine that went to Afghanistan. And my eldest daughter joined the Navy, and she was deployed in the Middle East. So I had a personal interest in trying to not only affect change about mental health care in the military for active duty and service members, but also selfishly to protect my own and future generations too.
Mark, let me ask you, going back to your dissertation and you're interviewing all of these combat veterans,
Yeah.
I was blown away gradually by my experience in doing that, going from West Lafayette, Indiana, as a professor into the great Midwest. And it took a lot out of me. How did you fare?
Oh, wow. Yeah. And I was completely unprepared. I mean, I was a
I was
psychology,
too.
I was a graduate student, right? But yeah, I mean, some of the stories just were, they hit hard. And, I didn't know how to process it, of course. I kind of kept them into me and internalized a lot of the stories. And
That's how you dealt with it, is you internalized it.
yeah, I stuffed it. I didn't really
So,
recognize it. And then, but I got to live what you wrote about in terms of secondary trauma, that as a Navy psychologist, after 17 years of that work, I am the prototypical impaired provider when it comes to secondary trauma. I have every aspect. So all that stuffing, all those stories, all the vivid memories of other people became my memories. My dominant emotion is anger, irritability, frustration.
mhm,
And I am amongst those who are struggling with PTSD.
mhm,
And although mine is more vicarious in nature.
mhm. Well, you know, in I want you to return to those contexts, those years of experience as a Navy officer and psychologist. But one of the things that I'm not quite sure of, but anyway, it happened when I faced the reality of the opportunity to do the interviewing, and I, like you, experienced, the backwash, if you will, from those experiences. I had the choice of saying, okay, woo, I learned something from that and never to do that again, or manage what I have acquired with regard to all the trauma and stress, et cetera, that's
Mhm.
balled up inside of me as a young professional at Purdue University. It led to my first divorce, actually, as it turns out, because she got caught up in all of this.
Mhm.
And that's one of the reasons why, from the beginning in this work, I focused on families, as you know, and
Yes.
very interested in that. But the real innovations, et cetera, are happening at another level contextually. So, I can't stick with families. I haven't been for some time now. But the thing that always struck me is when I am then have the opportunity by choice to focus on trauma, I began doing that. And I think what happened was that when I was presenting early on about combat and talked about the traumatic consequences of combat on those that I've studied, at least, I began to just talk about my own experiences and how, normal and natural and all that. And I mentioned it, we were part of a film that was made, and I think that was referenced in there. Those are the things that I was going through that I know it was due to military service and to combat and to people dying, etc. But it didn't, I guess I didn't allow it to enter fully into my psyche or into my attention, but it's creeped in along the way. I mean, it was like, oh, okay. And I found
Yeah.
that I became more understanding and sophisticated about those things the longer time went by.
Mhm.
So I never took any classes, or I didn't really read anything stirring that would lead me to get over my Vietnam experience. But it sort of like it just unfolded naturally.
Mm. So how did you, going from enlisted Marine, Vietnam combat
Yeah.
veteran, how did the idea of becoming, getting into social work, mental health, did your Vietnam experiences relate to that in any way? If you could talk a little bit about how you got into
Yeah, that's a great question. I was at the University of Hawaii, and I was I guess I graduated in 1970, but I can remember very well during that period of time because I was working, I got the GI Bill. So we were making fairly good money.
Mm-hmm.
But the thing that was impacting me at the time was not really Vietnam or anything like that. I mean, I certainly knew of kids. I guess they weren't kids for me, they were kids. I was a kid. For them, I understood, well, like I understand for myself, is that it's an extraordinary experience, something I had never experienced or intended to experience in my life, being in combat and being in the Marine Corps, for that matter.
Yeah.
But I think gradually, with various kinds of movies that one watches, as well as individuals that we talk to, I tend to be nosy. I ask a lot of questions, mostly because I can't carry around that many answers.
Yeah.
But in so doing, I'm able to understand myself better, as well as, mostly focusing on others. And I'm not exactly sure if it was an epiphany, but I began to recognize and be able to see myself outside of my own experiences, and began to think about transforming what I experience into something that would be useful. And I remember the first academic, well, it's the second academic job, I guess, because it was the first after I graduated. And I had the opportunity to go to Bowling Green State University as an instructor, actually. And the course primarily that I was teaching was marriage and family.
Oh, okay.
Social psychology of marriage and family.
Yes.
And it was wonderful. And first semester I had this many students, and next semester I had double that number of students. And I really enjoyed it and liked it, and they liked it too. And I gave great, I guess, for them, analogies, etc. But I hope this is part of your question. I started a rap group without really knowing.
Right.
Because I said, look, I am a faculty member here. If any of you have any interest in joining us, please do. And we had, 7 or 8 the first time, which was kind of remarkable.
And they were all veteran, Vietnam.
Oh, yeah, they were all in
Right.
Vietnam, which is kind of relatively unusual.
Yeah.
So it only lasted twice for various reasons. But I think I caught whatever bug there was to catch with regard to, veteran services or so. I mean, it's not like any services. I didn't get any money or anything, but just to connect with someone else who was a stranger, and you're able to connect with their military service and your military service. It's kind of weird, and I should be used to it by now. It's been many, many years since that time. How has been your experience in which you discover people are veterans, and then you make an effort at least to figure out, were we ever together? Were we ever stationed together or whatever? Does that happen to you?
Yeah, well, yeah, it's usually when you meet somebody new, they're a veteran, you talk a little bit about, where they were stationed or something like that, trying to find those points where you might have intersected, right?
But you knew they were a veteran in the start.
Well, no, of course, you don't know that just by looking at people, but if they introduce themselves as a veteran. Now, currently I'm doing VA disability exams, so I meet veterans, obviously. So that's a little different, but if I was just out and about, you might see somebody wearing a cap, says Vietnam veteran or Korean War veteran or Gulf War veteran, something like that. So, they wear some type of apparel that they're using to publicly inform us that they're a veteran. And so I've started up conversations with that and asked them a little bit about that.
Well, given the fact that you know their status, aren't there times in which you're talking to someone and it became fairly obvious to them or to you about their status, but they weren't sure about you?
Oh, sure. Yeah. And they'll ask, if I'm asking them about their service, they'll ask,
of course,
did you serve too? So yeah, that kind of segues easily into it. But yeah, I don't typically wear a lot of apparel, military apparel, partly because I guess I don't want to be asked. Some people are very open about it and welcome that type of interaction. And going back to this idea of secondary trauma, it's one of the things I kind of avoid, along with phones and so on. But if somebody does ask me, I will answer and strike up a conversation that way. Yeah, but just you mentioned the films that we were in, and that film, current film, is Strangers at Home, produced by Beth Dolan, and in that film too is Stephen Elliott, our friend, who was an Army Ranger who was involved in the tragic friendly fire incident with Pat Tillman, whose anniversary is coming up, or I passed, I think, recently. It's something in this general time frame. And the other film that I was involved in, this is back around 2015, is Thank You for Your Service. And this is not the Steven Spielberg version, but this is produced by Tom Donahue. And the reason why I'm in these documentaries, and this kind of gets back a little bit of who I am, is that when that admiral I mentioned came to our field hospital and said everything is done is very impressive, but will be forgotten and need to be rediscovered. As I said, that kind of lit up my memories of what I knew at then is the history of military mental health care that I had tucked away. It was dormant, and that ignited this DNA of outrage. And I started surveying uniform mental health providers from the Army, Air Force, and Navy, Marine Corps, and psychiatrists, psychologists, social workers, etc. Right, all the people who would be the primary experts that soldiers and airmen and Marines and sailors would go to. And I asked them a simple question: how many of you have been trained and or supervised in utilizing, administering any one of the 4 evidence-based treatments for PTSD? In 2004, the VA DoD published the very first clinical practice guidelines for PTSD. And they recognized 4 top treatments that they said everybody should have access to, right? So I already knew the answer to this question, but I went and surveyed these people when I got back in 2004 and 2005. I surveyed like 111 uniform mental health providers. The answer was about 97% had not been trained or supervised in any of the evidence-based treatments.
What was the percentage?
97%.
I knew it was high.
It was a whopping number. And I already knew that based on my own experience as a psychology intern and what I saw and how we train military psychologists and mental health providers in general. So I went to you, my friend. You may not remember this, but I was trying to publish this article and to get the word out. And I also submitted, before I published it, in a journal that you edit called Traumatology.
Oh, yeah.
This is back in 2007. That article came out. But before that, I had submitted my results of these training surveys all the way up to the highest ranks of the Pentagon and military medicine. And along with that was a plan and what we can do to correct that. And myself and Stephen Silver, who is a VA psychologist and ran one of the VA programs at Coatesville, Pennsylvania, we started training people on one of those evidence-based treatments called EMDR, which I know you're familiar with. It stands for eye movement desensitization reprocessing. A treatment that's been around since 1989 has been recognized by every international and domestic practice guideline as a treatment of choice for PTSD. And so you published that article. But before that, as I said, I started communicating the results of that training survey. And then Stephen Silver and I started conducting kind of regional EMDR trainings. We would go to different regions. So on the East Coast, West Coast, Midwest, in Asia, we did 6 of these regional trainings. And I think we trained about 256 uniform mental health providers, civilian and active duty, who were, working with military mental health, and gave them this free 6-day training, supervised, and gave them a protocol they could use, took back. And they went and took back their training, and we followed them up, at least some of them, about what was it like when you use this treatment now in your clinic, in your hospital. And we got, amazing results that they were saying, like, for people who had not been wounded in action, who had PTSD, they were getting significant reduction in PTSD and depression scores after 4 sessions, almost to a non-clinical level. And then if they had been wounded in action, it was 8 sessions. So it cost the government nothing. And we, instead of everybody having to go out and get their own training, which was the standard way of training mental health providers, we brought the training to these regions, saved millions of dollars, showed the efficacy, what happens when you use an evidence-based treatment, and why we should be doing this, because the war is ratcheting up, right? I mean, this was, again, 2005, 6, 7. So we were heavy into Iraq and the resurgence there. So I submitted probably about, I don't know, half a dozen or more memoranda and point paper all the way up the food chain, top of military medicine and all the different services as well. And got feedback. I got awarded a meritorious service medal awarded by President Bush and whatnot, for this effort, grassroots effort that me and the VA psychologists put together. And what they were told is that very good work, but they didn't do anything with this. They didn't implement it. They didn't support it afterwards. So people were still not getting the training. And I'm at that Marine Corps base in Iwakuni, where I was the only psychologist for 6,000 Marines in a rural base. And I'm covering 2 other bases with a pager and a duty phone that I'm on call 24/7 for 4 years I was there. And that's when hearing Congress hearings on military mental health care, the DOD leaders would go up there and say, we're providing the best healthcare, mental health care that has ever been afforded to warriors of any generation. And we have immediate access to top treatments, and people are getting help for, their PTS or whatever. And, we got well trained, we've got enough staff, we're doing Herculean efforts dealing with stigma and everything else, which is all bullshit. It was not true. So in 2005, I filed a complaint with the Department of Defense Inspector General Fraud, Waste, and Abuse hotline. And it was a 40 some odd page detailed analysis about where we're failing across the board with mental health care. Not enough staff, not enough training, not providing treatment, not dealing with stigma, not helping families, et cetera, et cetera. And I submitted, that was supposed to be a confidential transmission from me to the Inspector General, but I took my complaint and I sent it to all the Surgeon Generals in the military, and including the at that time, the current head of military medicine, because in my complaint, I alleged gross mismanagement, gross negligence was the word I used, gross negligence by military medicine for failure to meet mental health needs. And
you knew exactly what you were saying.
Oh, I knew what I was saying. I had the data to back it up. And that's where I became known. And my reason for being in those documentaries is that I became a military whistleblower at that time, which I tried vehemently not to be. But that was the last recourse in order to get the word out and get Congress and the top leaders in the Pentagon to take seriously this epidemic we were having in suicides and untreated PTS and domestic violence and all the ramifications of a rampant crisis and untreated mental health needs.
And that's terrific and wonderful, but it's part of your cynicism, part of your frustration and your...
Oh God, yeah. Yeah. Because unfortunately, not much has changed. And then we'll talk about in our next episode, I'll provide some evidence to that effect. There are people that are today, and I see it in my work with the VA right now, that there are people continually falling through the cracks and aren't getting afforded the type of standard treatment that has been recommended by the DOD and the VA in their practice guidelines.
Yeah, I mean, this kind of frustration about all of these men and women who've been in the military, including combat, and not getting the services they need. It's something that I've been fighting for, and looks like I haven't been fighting hard enough because...
Well, I don't know. I don't think that's the issue. It's
Yeah.
like who's hearing this, right? And who's accountable, who's responsible for making changes when it comes to mental health care. And yeah, I mean, you've written, as I said, volumes on trauma and the effects of war and et cetera. And the information's out there. It's known. This is not something that's secret or that has to be discovered. But yet every war, we kind of have to rediscover these lessons, don't we?
But we have made sure that people are able to easily access the highlights of the tremendous work that we've been doing because, I'm very proud that this is our book, Psychiatric Casualties. It's not like we're advertising it or anything here. There's hardly anyone who knows about it, seems to me. I mean, we need, as collectively, you and me, need to do a better job of pushing it out there. But,
Yeah.
well, I was just going to say that the attention span is very short. And it's interesting now that we are ratcheting up potentially another war, et cetera, that may change. But
Yeah.
it's heartbreaking, frankly. And I know that, okay, fine, heartbreaking. We can only say that once. But my hope in this series is that we will come awake, that we can generate other people who get worked up as we have, and that we can collectively do something and continue the pressure, continue, the effort.
Yeah, absolutely. I mean, it's going to take a groundswell and, from veterans and military families, but also people who are not affiliated with the military, because the lessons of war trauma affect how we treat trauma in the private sector as well. And just like battlefield medicine has, all the innovations in medicine and in emergency care came out of a lot of that came out of the military experiences, and that affects civilians all. So all of us have a stake in it, and it's trying to get the information out so that we get enough of a groundswell where you get journalists who might be interested in the stories to investigate a little bit. And we get, more importantly, the politicians who are too busy squabbling amongst themselves, but all of which, whatever left or right leaning or in middle, all of which pontificate of these support to veterans and their families. And, it's time to put the money in where the mouth is, I guess.
No, that's a good way to put it, for sure.
Yeah, but so, our book that we keep referencing, we're going to be going through in this show various chapters through this book, and we're not trying to sell this book. We donate the proceedings to nonprofit, so there's no personal gain from this. But the book is titled Psychiatric Casualties: How and Why the Military Ignores the Full Cost of War. It was published in 2021 by Columbia University, which we're eternally grateful for. And it is the first and only book ever published that really analyzes about the generational crisis in mental health that we view as largely preventable and self-inflicted. And more importantly, we give concrete solutions, not that we dreamed up, but that have been recommended from each generation, since the First World War. And so there is a blueprint already out there, and we're just kind of repeating it and maybe framing it in more modern terms. But that's what we'll be talking about in future episodes, is not only why we have these crises, but more importantly, what we can do about that to end this cycle of mental health neglect and stigma, and both in the military and outside the military.
Yes, I want to bring up something that is rather timely. I got a note from the International Society for Traumatic Stress Studies. It's one that organization's been around, coming up on 40 years, and they're organizing the 40th anniversary. I don't know if you've been contacted yet, Mark, but the organization is very important because it was the first organization focusing on trauma. It's like, by the time finally we're doing that. But in the effort to for the 40th, they're inviting a panel of past presidents. And I served as president of it was called the Society for Traumatic Stress Studies, not necessarily international. Mm-hmm. We assumed we didn't have to say international because trauma affects everybody and
Yeah.
is found everywhere. So anyway, but that was we founded the organization in 1985, and I served as founding president. But we weren't able, believe it or not, we were not able to find a consensus about who would be the next president. We had various factions, oh my gosh, within the organization already that were lining up. So I went ahead and did it for another year. And, was associated with the organization, obviously, for more than just a couple of years, have been for a long time. But the point here is, I remember the first initial times that we were all together. And I think the first one, the first, it's on paper and it's in the history books. That was in Atlanta in 1985. And that's the same year my second daughter was born. And during that period of time, here's an example of a group of attendees attending a conference that you wouldn't have thought about. Airline stewardesses. Maybe they're not even called that anymore. I'm sure, probably.
Attendants.
They have a team of airline stewardesses, females, but they're also males as well, that were trained in disaster mental health, were trained in the possibility that there would be a crash or there would be an emergency experience. Obviously, they need that training, and they have it. But they had a lot to train us. They had a lot to say about our own education, and that's what happened. But the interesting thing about the goofiness of professionals, and I'm a psychologist, not a psychiatrist, I'm a family therapist, whatever, there was this sense of superiority, I think, among some members about, well, I'm advanced degrees and I know what's happening. I have a law degree or medical degrees, etc.
Right.
But those women were extraordinarily talented and articulate, etc. So at least for the first several years, I think the membership recognized that those who were presenting on trauma did not have to have any degrees after their name, that they had professional standing, and they would have been vetted, if you will. But I think that those stewardesses serve in many ways to remind all of us of how consequential trauma is and how universal it is, and how all of us need to be educated about it, whether we care about the military or not. And I think that's happening today, but it certainly wasn't the norm in 1985.
Right.
The society was founded. Mark, when did you hear about the society, or the International Society?
Well, I know I don't know if it was during my time doing my dissertation, but certainly when I left graduate school, I think I became a member of the society.
Okay.
Because I started getting the journal. I think it was a journal of traumatic stress.
Yes.
Right. It was the flagship journal, really, at that time. I think that was the only journal that was dedicated to the field of trauma. Am I right on that?
Yeah, traumatology was the second. Yeah.
Yeah. So I mean, and they published clinical practice guidelines too for PTSD.
Yes.
And so I always try to keep up with what are the new renditions of that. And
yeah, it's very interesting in terms of how things are falling out or unfolding, let's say, following the pandemic. I mean, I know following is even incorrect, and that there's this continuation to a certain extent, but there have been major shifts, and I think a lot had to do with we were all cloistered in our homes and peeking out from time to time. It certainly was a time of turmoil with regard at the national level, which is where we are today in 2024.
Absolutely.
But it was a challenging time. And I think for ISTSF, the American Psychological Association, there was a tremendous amount of turmoil, not knowing how things would fall out. Obviously, we know the notion of how employers were concerned about their employees returning to work following the pandemic. And we all now know how we all liked the flexibility. We like the Zoom that we're utilizing now.
Right.
So I think that it has made a major change. But the thing that I have seen during the pandemic is among the students, that I'm working with.
Mm-hmm.
And the students seem to be far more willing to admit they have a mental health issue or challenge or consequence. Maybe it's different in
Yeah.
Washington State, but
No,
in the
no.
New Orleans, man, yeah.
Yeah,
So that has
there is.
been
Yeah.
very refreshing, and it's
Mm-hmm.
certainly increased the enrollment in our classes. So
Yeah, I think it's interesting that you say, and I think there's some truth to that, that the current generation is more open to talking about mental health. There's less stigma, at least, for this younger generation. Will that hold true as they move forward in their lives when they start to, develop working careers and things of that sort will be something, but it's certainly promising. But stigma is such a huge problem, and we have a whole chapter dedicated to what we refer to as the weaponization of stigma. And the military has, purposefully used stigma in order to keep the numbers down and to avoid, dealing with the mental health dilemma, which we'll talk about in another episode. So,
you
but it's encouraging. It's an encouraging sign, at least, that we might be making some movement on that.
can you give examples of that with regard to the stigma and dealing with it, addressing that? I guess what I'm getting at is that I see that also among the faculty and among students in terms of pushing back and pretending you're not having these issues.
Yeah.
Part of it is the professionalization, because the social workers that I work with, I'm a psychologist, but I work with social workers.
Mm-hmm.
It is, they're at a master's level already.
Mm-hmm.
So there is the expectation, that they're going to be better. But tell me about the experiences and any great examples of what you're talking about with regard to mental health and the untreated, and those that suck it up and try to hold on and move forward and all that sort of thing. Are there stories that
Oh, goodness.
think of?
Yeah, there's no shortage of stories. They say, 2 days a week I'm doing, these VA disability exams, and these people coming, men and women coming out of the military. And I could say probably 70% or more had no identified mental health problems in their service treatment records because they never disclosed that. And, universally, the reason why was, one, it'd be perceived as weak. So that's not what a soldier or a Marine wants to be perceived as, right? It's weak. Secondly, they would be concerned about, well, if they were taken out of their role, that would affect, somebody else would have to fill their role, and they would feel guilty about leaving their, their war buddies in that sense. And overwhelmingly, a fear of reprisal from their careers. Like, how would this impact a submariner or a pilot or anybody who is in a deployment or a security clearance? So overwhelmingly, people don't speak out about mental health. Again, there is certainly a subset that will, maybe 20, 25% that I see have in their records where they actually broach the stigma, but overwhelmingly most don't. And then I have to help them create the reasons why, and that, these conditions actually started on active duty, even though they were not identified at the time. So, the stories are that, as I said, they're just worried about what would happen to them and their families if they came forward and identify themselves as struggling in some way.
The same is true for first responders.
Oh, yeah. I think some of the worst, to be quite honest, are our fellow mental health professionals. I'll put myself in that boat too. Right? The last thing you want to be as a mental health professional is identified as an impaired provider. And that, just by the fact that you might be struggling with depression or anxiety or PTS or whatnot, doesn't mean that you have that condition, you're actually impaired, but that would be the fear, the perception of how people might take that if they associate your name with having a condition. So we are usually very reluctant as a profession to actually seek help, even though we're the ones often, we're the ones giving advice and giving the help. And sometimes
I was invited to University of Georgia make all-day presentation, basically in the area of self-care, but also colleague care, etc. And there were a number of discussions about that, about how you have to accept the fact that this is impairing, this is impacting, etc. But then what do you do with regard to clients? They need to be confident in their practitioner.
Oh, yeah.
So, yeah, the model that I developed is 13-item model. It has self-care going directly to secondary trauma.
Yes.
The area of specialization. So there's lots and lots of things that we can do just in terms of our own taking care of our own self, which is wonderful.
Oh, absolutely. And again, thank you for writing the book on compassion fatigue and secondary trauma. But, in future episodes, I'll be sharing my own personal struggles with that and how I broke down and how that affected me, my family, and the patients that relied on me due to not practicing good self-care. Again, doing exactly the opposite as we preach. So I am guilty of that as charged. Hey,
the cause of that, young man, is, what is it, 4 years in the Marine Corps before you went into the Navy? I mean, fine, you were a jet mechanic, okay, but still, you were around jets.
Oh, well, yeah.
Why?
Yeah, well, I mean, one of those being around jets was, as a young enlisted Marine jet mechanic, as you said, we had a plane we had two-seaters. They were A4TFs that were trainers, A4 jets. And in the back seat was the CO of the base, and the front seat, the pilot, was a major who was the XO of our squadron. And it was a wet day, and they tried to do a landing, and apparently they didn't jettison all the fuel in their tanks, and they skidded on the runway and then went into the grassy area and flipped several times. And the colonel was beheaded, and it was just gruesome as all hell. And who's out there picking up the pieces literally, or is yourself, myself? We did a FOD walk, as they would call it, and we just go and pick up pieces of, human matter and parts and everything else. And so, trauma is a occupational hazard in the military, regardless of our vocation. There's all kinds of things that we're exposed to, but we'll talk about that more in future episodes. And, as we wind down here for this first episode, do you have any parting thoughts?
I guess I feel better and more confident now that we're doing this sort of thing, but we've talked together about a lot of things over the years. And I think we naturally slipped into that kind of give and take, etc. I mean, you all can only hear us, those of you who are listening. We can see each other, and eventually we'll have video. But I guess I feel better now than I did, when we started, simply by, getting used to the banter.
Yeah.
But in all seriousness, I really do hope that this is potentially a life-saving, or contributing to saving someone's life by hearing about it. We're not particular about whether it's a veteran or not. There's lots and lots of family members that would naturally be drawn to this kind of information and feel more connected. So I hope that will happen as well.
Yeah, and so do I. We again, all we can do is put the information out there, but we also would welcome people's feedback too. So I'm going to give an email that people can reach out to contact us through to ask questions and all that. We're going to stay away from kind of getting to clinical work. So I don't want to step into that role. But as far as a repository for questions or comments, you can email mrussell, RUSSELL, PhD @gmail.com. mrussell, PhD @gmail.com. And we will get to your questions, and we may use that discussion as a way to come for future episodes as well. But this next episode, that will be going into the introduction of our work on psychiatric casualties, the how and why the military ignores the full cost of war. And we'll look forward to talking with you then, Charles.
Yeah, that'd be fun.
All right. All right. We'll sign off for now. Everyone be well.
Thank you.